Good afternoon, and welcome to today's caregiver webinar, Brain Health, What Caregivers Need to Know. My name is Katherine Hall, and I am the Caregiver and Support Services. I'm the specialist for the Caregiver and Support Services unit with the Area Agency on Aging. Just a few housekeeping items before we begin today's session. A link of the recording is being recorded, and slides will be sent to you by next week. We have enabled closed captioning, and you can turn your captioning on or off using the Zoom panel at the bottom of your screen. If you have any questions during today's webinar, please hold it till the end. We will try to get through as many questions as possible. And there will be a quick survey as you sign out. If you can please take a moment to answer those questions, it will help us create programs that are relevant and interesting to our caregiver community. Now, I would like to introduce to you our speaker today, George Worthington. As a Dementia Services Director for the Virginia Department for Aging and Rehabilitative Services, George supports the Alzheimer's Disease and Related Disorders Commission, drives the implementation of the Dementia State Plan, reviews existing programs, and works with other agencies to more efficiently deliver services to Virginians living with dementia. A native of Charlottesville, George has worked in human services for more than 10 years, since shifting careers from economics. George has a Master of Science in Clinical Psychology from La Trobe University in Melbourne, Australia, in addition to a Master's of Science in Economics from London School of Economics. George, feel free to join us on camera and take it away.
Thank you so much, Catherine. And hello, everybody. Welcome to today's session on brain health, what caregivers need to know. So hopefully you can see my screen at this point. And these slides will be shared with you. So you'll have all the links and the information. So today I'm going to give you a brief overview of dementia and talk about the modifiable risk factors for dementia. And then I'm going to talk very briefly about 3 studies that highlighted our improved knowledge about the impact of lifestyle interventions on brain health. And I'm going to ask you, I know you can't respond, but how many people had actually heard of brain health, say, 10 years ago? Probably not too many of you. But I'm sure you've all heard of heart health. And so we're going to talk about the links between heart health and brain health. And then I'm going to talk through specific pillars of brain health, things like sleep, nutrition, exercise, and give you some strategies for things that you can do to support your own brain health as well as that of your loved one. And then finally, I'm going to give you a few resources, and then we'll have time for questions. So I look forward to hearing those. So just to level set, dementia itself is not a disease. It's an umbrella term that describes the symptoms that we think about when we think about dementia. Things like memory loss, forgetfulness, changes in mood or personality, changes in perception, and changes in your brain that are interfering with your daily life. So under that umbrella term, there are many different conditions that cause those symptoms. You may have heard of many of these: Alzheimer's disease, Lewy body dementia, vascular dementia. These are the progressive neurodegenerative diseases that cause what we think of as dementia. There are other causes of these symptoms that may be treatable and reversible. And so it's always good to speak with a healthcare professional if you're noticing changes like this in your loved one. Some examples might be a urinary tract infection or a vitamin deficiency can cause those symptoms of dementia. And just an indication of the scale of dementia in Virginia. So 1 in 6 Virginians over the age of 45 is experiencing thinking or memory changes that they feel are getting worse over time. That's quite a lot of people. That translates into about 450,000 people in Virginia who are self-described as experiencing these changes. So not all of these people will have dementia, but many people might be sort of on the way to mild cognitive impairment or later dementia. So again, it's really important if you're noticing changes to get those checked out. But now we're going to talk about some ways that you might delay or even prevent some of those changes. So I'm going to talk about I'm going to talk first about why brain health is important. So this is a graphic on the left from the Lancet Commission. I know it's pretty small. The Lancet Commission is a medical journal in the UK, and for the last 5, maybe 6 years, they've been publishing regular updates to their dementia risk factors information. When they first published it back in 2018, they had a list of 9 modifiable risk factors that could maybe prevent up to 35% of all dementias worldwide if they were all addressed. That list has now grown. There are now 14 modifiable risk factors for which there's a strong evidence base. And you can see those listed in the table here. And when in your lifespan it's most effective to address those. So the only thing that most of us can't do anything about anymore is education. So education in early life is really important. It helps give you the cognitive reserve that may help slow or delay progression of these neurodegenerative diseases later in life. But there are many things that we can do in midlife and later life. These percentages, they're all population level statistics. So they don't necessarily indicate your individual risk profile. That will look quite different. But it does give you a suggestion of where to maybe focus your efforts as you think about doing things that can improve your brain health. So in midlife, that's 40s, 50s, 60s. Hearing loss is super important. So that means making sure that people have hearing aids. I'm going to talk a little bit more about this in a second. But you can see high cholesterol is also important, and other cardiovascular factors like high blood pressure or hypertension, diabetes, smoking, obesity, all of these affect your heart health. But there are other areas that can make a difference as well. And even in later life, addressing things like social isolation or vision loss can help your brain health. So why is this important for caregivers? So addressing your brain health can make you healthier in general. As I said, there's that link between heart health and brain health. If you're physically healthy, you're more able to look after your loved one. And it also helps you maybe manage your stress and mental health, may enhance your caregiving abilities, and of course, slowing that cognitive decline. We are learning more and more about the impact of caregiving responsibilities on people's cognitive health. And there is some indication that caregiving itself might be a risk factor for cognitive impairment. It should help improve your overall well-being and also may promote positive relationships, particularly if you're addressing that social engagement piece, which I'll talk about more in a minute. So I'm going to talk about 3 studies that came out over the last 15 years that really informed a lot of our thinking today about brain health and the modifiable risk factors for dementia. So the first study is called the Finger study. I can't remember what that stands for, but I know the Fin stands for Finland because that's where this study was done, but it's been replicated in many other countries around the world, including the US. So this study was the first big randomized controlled trial. And that, if you're not familiar with research, that's the gold standard. A randomized controlled trial is one where people are randomly assigned to a control group, typically, and an intervention group. And if the people receiving the intervention show differences on outcomes compared to the control group, then we can infer that intervention has made a difference. And that provides evidence for its efficacy. So this study looked at a control group getting general health advice and a trial group that had a multi-domain intervention on diet, exercise, cognitive training, and vascular risk monitoring. So watching that heart health. And these findings suggested that this could improve your cognitive health. In fact, the intervention group saw a 25% increase in their cognitive performance over the trial compared with the control group. So that's a big improvement. And then thinking about genetic risk, there's a gene, the APOE4 gene, which is associated with Alzheimer's disease. Those folks also had clear cognitive benefits from this type of intervention. And this really got people thinking about what can we do better to help improve brain health. Another study that that really helped change our thinking or shift our thinking was the Sprint Mind study. This was done in the US, and it looked explicitly at the link between high blood pressure and dementia risk. And again, this was a randomized controlled trial. They were in the treatment group, people were getting aggressive high blood pressure or blood pressure treatment to keep their blood pressure below 120 over 70 or 80 compared to the standard care for the control group. The results were so huge that they had to stop the study early because it was unethical to deny that treatment to the folks in the control group. So keeping blood pressure below 120 had a very strong impact on people's cognitive health. So while that hasn't filtered through to recommendations at the general practice level, where I know that's under discussion, and those guidelines for high blood pressure treatment may be updated to reflect this new knowledge. Finally, the U.S. Pointer study. This was the largest trial to date, looking at lifestyle interventions in older adults, specifically who are at increased risk for cognitive decline. Again, this was a randomized controlled trial. People were randomly assigned to two groups, one where people just received some general health advice and some coaching, and the other where they had a very strict regime that included a group that included exercising 4 times a week, following the MIND diet, which I'll talk about in a minute, doing some cognitive stimulation through computer training, and also getting guideline-based health coaching. So they were being asked to set goals and try and work on their health to achieve those. This study just reported out 3 weeks ago, so hot off the press. And what it showed was that people in both groups saw an increase in their cognitive performance compared to baseline at the beginning of the trial. That's really encouraging. But the group that had that more structured, more intense intervention saw a larger increase. And the difference was statistically significant. So it does give more evidence to the impact of these types of interventions on brain health. And this was just the outcomes for that study. So you can see the average age of people in the study was nearly 70 years old, mostly female, and that's about the same percentage. So about 2/3 of people living with Alzheimer's disease are women typically, and nearly 90% of folks completed the full 2-year intervention, which is pretty amazing. So now we're going to talk about some specific areas of brain health and those modifiable risk factors for dementia and what you can do to benefit your brain, even as a busy caregiver. So let's look at heart health first. This is several of the dementia risk, modifiable risk factors for dementia are around heart health. So high blood pressure, high cholesterol, diabetes, smoking, and obesity. Not only does managing these conditions help improve your overall health and, of course, help maybe reduce your risk of having a heart attack or other type of cardiovascular event, but that's also good for your brain. Your brain is a is an energy intensive organ. It's only about 5% of our body weight, but it uses up nearly 20% of all the energy we put into it. And that energy, think oxygen and glucose from the food you eat, needs to get to your brain via the bloodstream. So if you have issues with your bloodstream or your blood vessels or your heart, it's going to make getting those nutrients to your brain more difficult. And in fact, that's what causes cardiovascular dementia. Sorry. Uh, that can be caused by a big stroke or maybe a series of mini strokes called transient ischemic attacks, or TIAs, you may have heard of. Uh, and so that link is really strong. There's lots of good evidence for this. And if you take one thing away from today's webinar, that would be what's good for your heart is good for your brain. So looking after your heart health is looking after your brain health as well. Okay, so nutrition. I'm going to talk a little bit about the MIND diet, which I mentioned a minute ago. This was the diet that the US Pointer folks followed. Uh, the diet itself is a combination of the Mediterranean diet, which I'm sure all of you have heard of, and the DASH diet, which you may not have heard of. But the DASH diet, DASH stands for Dietary Approaches to Stop Hypertension. So it's a diet that's specifically aimed at reducing high blood pressure. It's been around for quite some time, and you can find lots of information on the internet, recipe books, meal planners, all sorts of things about the DASH diet. 3 years ago, you couldn't find anything like that for the MIND diet, but now things are starting to appear, and you can actually find meal planners and recipes and things like that. The MIND diet, it's a heart healthy diet. There's no strict guidelines like some other diets may have, but really it's just about eating more of 9 foods that we know are really beneficial to the brain and your body. Green leafy vegetables, all other vegetables, berries, nuts, olive oil, whole grains, fish, beans, and poultry. Uh, so things that we typically know that are good for us. And then eating less of 5 foods. So butter and margarine, cheese, red meat, fried food, pastries, and sweets. So all the fun things. But it doesn't say don't eat these at all. We're only human, right? We need to treat ourselves from time to time. And it just says eat less of these things. So maybe cutting out 1 or 2 serves a week to begin with, and maybe trying to do that over time, reduce your intake of these 5 foods. We're not sure exactly why the MIND diet is beneficial, but it may help reduce oxidative stress. I'm going to talk a bit more about inflammation in a minute. And while that wasn't a risk factor on the table at the beginning of the webinar, we there is increasing evidence that inflammation, chronic inflammation of the brain, is linked to dementias, including Alzheimer's disease. So exercise, another brain health pillar. The slide says of all lifestyle intervention study, exercise seems to be one of the best things that you can do to reduce your risk of dementia. And that certainly was borne out with the Pointer study, which had very strong exercise component. Most studies looking at these links look at aerobic exercise, but there's increasing evidence to show that a mixture of aerobic, strength training, and balance and flexibility training can be really beneficial. The guidelines for working out from the federal government of about 30 minutes of exercise a few times a week or 5 times a week seems to be borne out by the research that's going on. This is a good amount of exercise to aim for. It may not be achievable for everybody, particularly for busy caregivers. People often wonder what's the best activity to choose. And the answer to that is choose something that you're going to enjoy and stick with it. If my doctor told me I should be swimming laps to improve my heart and brain health, I'd say, great, and then I wouldn't do it because I hate swimming laps. But if he said, choose something that you would continue to do and stick with it, then I'd do what I already do, which is walking and other things like that. So things that you don't necessarily think about as being exercise can also be having similar benefits for your body. So things like gardening or housework can also be considered exercise. Just about getting your heart rate up and maintaining that level of intensity for 20 to 30 minutes. And here's some other types of exercise that might be good: yoga, swimming, water aerobics, tai chi. For caregivers, uh, we know you're busy, so what is the best thing to do? Sorry, and I forgot to give you the tips for the mind diet, but for your nutrition, if you're thinking about maybe making some changes to your diet, and you're just overwhelmed, how can I even think about this? I've got so much on my plate. Start small. So maybe if you swap out olive oil for butter or margarine, uh, or maybe spending a few minutes at the beginning of the week to actually plan out your meals a little better rather than doing things on the fly, making use of things like grocery delivery services to help maximize your time. Those can be helpful. For exercise, again, start small. So always good, of course, to talk to your doctor before starting a new exercise regime. But maybe with exercise, you could start with a say 30-minute walk once a week. Maybe you want to go with a friend to actually get some socialization in there as well. And you can also do things like find workout routines online. There are lots and lots of things like chair yoga or regular yoga or Tai Chi that you can follow online through YouTube or others. Uh, just short, 5 to 10 minute or 15-minute exercises, and pick those up a couple of times a week to start. You may find that the impact on your mood really makes you want to keep doing more of that. So sleep. This was not on the table that I showed you at the beginning. Sleep is thought to be a fairly strong risk factor for dementia, but it's very difficult to study. So getting that evidence that links sleep and good sleep to lower dementia risk is difficult. However, there are some studies that show that people sleeping 6 hours or less in midlife, remember that's 40s, 50s, 60s, had a greater risk of developing dementia. In fact, 30% more likely to be diagnosed with dementia later in life than people sleeping 7 hours or more. Uh, and quality sleep plays an important role in lots of things: concentration and learning, mood, overall health, and I'm sure you can see how those link to your caregiving responsibilities and abilities. Sleep is also important while you're asleep. Your brain is not sleeping; it's quite busy. So there are different stages of sleep, and your brain is doing different things in those different stages. There's one stage where all your neurons are firing in synchronous waves, and you can actually measure those waves through electrocardiograms, just waves of electrical activity sweeping over your brain. There are other parts of sleep. You may have heard of REM sleep. REM stands for rapid eye movement. So if you lift someone's eyelid when they're in rapid eye movement sleep, their eyes will be flicking back and forth. This is typically when we're dreaming the most, and we think that that's associated with learning and memory. So consolidating your memories from the day before, and thinking about if you ever pulled an all-nighter in high school or college to study for an exam, you may have found that you didn't actually do as well as you thought you might because your brain didn't get a chance to actually consolidate that learning before you went into the exam. So much better to get a good night's sleep, get that memory and get those memories down. So for caregivers, what can you do? And I often hear from folks that sleep is a really difficult one. Often your loved one is maybe following a different sleep wake cycle. So they're awake more at night. and sleeping during the day, and you need to get things done during the day, so you can't actually match that. But you can maybe set a cutoff point for uh, your activities every day. So you maybe got your loved one settled, and you have a little time to wind down before you go to sleep. Thinking about reducing screen time before bed, uh, those sorts of things can be helpful. Making sure you've got a dark environment, so maybe wearing a sleep mask can be helpful. Stress reduction. So stress was another risk factor that wasn't actually on that first table I showed you, and it's for the same reason as sleep. It's really hard to study. If you are trying to study stress, you have to put people in stressful situations, and often that's not really very ethical. So uh, there have been some really, in fact, there were some really terrible studies in the mid 20th century that prompted a revolution in our thinking about human subjects research, and many of those were around putting people into stressful situations. So people vary widely in their stress levels and how they respond to environmental stressors. But we know that caregiving itself is a stressful occupation. So we would expect people who have high caregiving responsibilities to be a little bit more stressed than somebody who doesn't. And that can be damaging to your brain. So it's really important to think about ways that you can help reduce your stress. So we're not exactly sure about the links between stress and brain health, but we think it's from elevated levels of cortisol. So cortisol is a hormone that your body secretes when you're in a stressful situation that helps prepare you for that flight, fright, or freeze response to threats in the environment. And elevated cortisol levels are also linked with memory problems. And if you think about it, when you're in a stressful situation, you're paying attention maybe just to one thing, and your attention is shutting out everything else that's going on. So you're getting in less information about your environment, and that can actually help impact your memories. Uh, Chronic inflammation could be another potential mechanism that chronic inflammation stimulated by those high levels of cortisol. And again, that inflammation is increasingly linked to Alzheimer's disease and other dementias. And there is a demonstrated link between post-traumatic stress disorder and a higher risk of dementia. So things that you can do, again, you don't have to spend an hour meditating every day to reduce your stress levels, although that would be great. But I'm sure you don't have time for that. But other mindfulness activities can be really good. For many of us, when we think of meditation, we think of somebody sitting cross-legged in the lotus position and trying to clear their minds. Well, if you've tried that, it's very hard to do. So there are lots of things that you can do that don't require that level of practice that you can just pick up in your daily life. Um, for busy folks, just a couple of minutes thinking about your breath, or focusing and concentrating on your breath, breathing in, breathing out. You can find lots of 2-minute mindfulness exercises on the internet that can help you learn a few techniques. And again, practicing these makes them much easier. I know there was an effort at the University of Virginia a few years ago to have a pause that refreshes. And every time nurses were disinfecting their hands before going into a patient's room, they were asked to stop and focus on their breath for 15 to 30 seconds. And it did reportedly help reduce their stress levels. So, and their feelings of competency in their jobs. So just even that short pause, thinking about your breathing for a few breaths can help reduce stress levels. And again, there's lots of things that you can find on the internet to help learn more about mindfulness and help think about how to reduce your own stress levels. Social engagement. So this was another risk factor that was on the table. Social isolation later in life is thought to be quite damaging to your brain health, and there are lots of reasons why. Uh, there's, as the slide says, there's some studies that show that larger social networks may help prevent cognitive or may help protect against cognitive decline. That doesn't mean having 500 friends on Facebook. That's a larger social network for sure, but it's not necessarily a quality. It doesn't necessarily mean that you're having quality relationships with all those people. And in fact, that would be very hard. So having a few good quality relationships in your life is important. So I'm going to talk about the difference between loneliness and social isolation because this is important here. So social isolation is something that's objective. You can measure it. I live on a farm. My nearest neighbor is about half a mile away. So by definition, I'm relatively socially isolated. However, I'm not lonely. I go to work, I see lots of people, I have lots of meetings like this, and I'm not lonely. So loneliness and social isolation aren't the same thing. And it's thought that maybe that loneliness, that lack of quality social relationships that makes people feel sad, that itself may be associated with a higher risk of dementia, not so much the social isolation piece. So things that you can do, participate in clubs, maybe volunteer for something or other community pursuits, checking in or having a meal with friends or family on a regular basis. Again, finding activities that are meaningful for you and that add to your life, that don't actually make your life more difficult. So focus on relationships that you enjoy most, and even caregivers can do that. Better to have a few quality relationships than lots of kind of low quality relationships where you don't have that strong social engagement. Hearing loss. Okay, so this, if you remember back to that first table, uh, this was one of the biggest risk factors for dementia. So if we addressed hearing loss worldwide, if everybody who's experiencing hearing loss received hearing aids and was trained in how to use them properly, we might reduce the number of people developing dementia by 7%. So that 7% doesn't sound like a lot, but that's many, potentially millions of people that might have developed dementia that wouldn't simply because they have hearing aids. Now, this link is a little controversial. There are studies that suggest that as hearing loss worsens, that people are at increased risk of developing dementia. And when we think about why that might be, think about what information are you getting through your ears? So you're able to participate in conversations because you can hear what people are saying. You're getting audio 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 cues from the world around you, so things like thunder, maybe time to shut the windows, those sorts of things. You're getting information constantly through all of your senses, but hearing is particularly important. So if your hearing is getting worse, it can make your brain have to work harder, devote more resources to hearing, or fill in those gaps in your sensory information. And that will reduce the resources available for things like thinking or memory or concentration. So it can make all of this worse. And if your brain, it's parts of your brain are use it or lose it if you're not using them, if they're not being regularly stimulated through some sort of information from the world around you, those neurons are going to shrink. They will have fewer connections with the other neurons around them. And that may lead to just worsening cognition over time. So I'm going to mention one more study. So it's here, the Johns Hopkins ACHIEVE study, which stood for Aging and Cognitive Health Evaluation in Elders. This reported out a couple of years ago, and it was looking at the explicit link between using hearing aids and dementia risk. So they had nearly 1,000 participants. Um, Most of them were in their late 60s through to mid 80s. And there were two groups. There was a group that had a hearing intervention where they received hearing aids and were taught how to use them properly. And then the control group had just some healthy aging advice over 3 years. And what they saw was that while the treatment group saw a big improvement, so these are the people that received the hearing aids, they had a big improvement in self-perceived ability to communicate compared to a worsening for people in the control group that didn't receive the hearing aids. The actual statistical results showed that the benefits from hearing aids really accrued to people who had a genetic predisposition to Alzheimer's disease. So that's people with maybe the APOE4 gene, or who had a first degree relative, a father or a mother who had Alzheimer's disease. Those people at higher risk saw more benefit from receiving the hearing aids. And since this was kind of a nuanced result, unfortunately, it wasn't strong enough to convince Medicare to provide hearing aids, but that day may come. Okay, so head trauma. Um, Head trauma, this this is obviously damage to your brain, so usually caused by things like car and bicycle accidents. For older people, falls are the biggest cause of head injuries. And the links between head trauma and dementia are very strong, unfortunately. So, having one moderate brain injury in your life, which I believe is losing consciousness for under 24 hours, but more than 12, increases your risk of dementia by about 2.5 times. If you have one serious brain injury in your life, and that's losing consciousness for more than 24 hours, you have more than a 4 times greater chance of developing dementia. And head injuries are cumulative. So the more head injuries you have, the more likely or the higher your risk of developing dementia. Uh, for me, I live in an old house with low doors and I'm quite tall. And so I periodically smack my head on a door frame. I do worry about my risk of dementia as a result, but certainly things like football players who are having that on a regular basis, we know that's associated with brain degeneration. Things that you can do, make sure you wear your seatbelt, or if you bicycle, wear a helmet or other protective equipment. If you're concerned about your balance or feeling a little wobbly, use a walker or a cane. It's much more important to maybe put that pride aside than it is to fall. Falls, again, are the biggest cause of head injury for adults. Make sure that your vision is checked. If you can't see where you're walking, you're more likely to trip over things. And think about medication side effects as well, because these can sometimes affect your balance or your coordination. And then also think about environmental risks. So if your space is cluttered, it will be more difficult to move around. If the lighting is bad, it'll be harder to see. Things like throw rugs are a serious trip hazard. So lots of things to think about, and these are kind of small things that can help reduce your risk of head trauma. Also, doing falls prevention or balance or falls prevention classes. So your area agency on aging, Fairfax area agency on aging, may offer falls prevention classes that can hit several of these brain health pillars. So you're doing something in a group, so that's social engagement, and you're participating in something, you're learning something, so that's good for your cognitive health generally, and you're also learning ways to prevent head trauma, which can help minimize this risk. Okay, so the last one I'm going to talk about is brain training. Brain training is an interesting one. you might recall that it was part of those interventions for the US pointer study and the finger study. But there's no clear evidence that any particular training. So when you think about, well, what's the one thing I should do? We don't know, but there is a good understanding of things that are likely beneficial. So things that are more mentally challenging than less are going to be probably better for you. Uh, those apps and games that say that they're going to help your cognitive health, maybe not so good. What happens there is that you get trained into doing one little specific task very well, but it doesn't necessarily generalize to other areas of your life. So things that you can do, play games that have strategy. So something like bridge or chess, where you have to think several moves ahead and hold lots of information in your brain. Those are really good for you. They help stimulate those connections between the neurons that can help be protective against dementia. Think about reading higher level reading material, newspaper articles, long form articles, things like that can all be helpful. Doing some formal education or webinars, things like that. So most areas of the state have lifelong learning institutes. So you can join a class there. Again, you get some social engagement as well. They often recommend learning a new language or instrument, and I know people throw up their hands and say, "Well, that's just too hard." But even just the process of learning a new language, even if you can't speak it at the end of your class, is good for your brain. You're making new connections again between your neurons and helping build what's called a cognitive reserve. Doing art classes, online courses are great for caregivers. I've been doing a chemistry course myself online at a university. It's free because I never did high school chemistry. I'm finding it very hard going, I will say, but I'm probably making some new connections and maybe helping reduce my risk of dementia. So for caregivers, you can also do little things like maybe learning to do a task differently, like brushing your teeth with a different hand, taking a new route when you drive somewhere, uh, or take some time to learn something that can be helpful for you in your role as a caregiver. There are lots of informative uh, lectures and training programs that are available through YouTube or through the Alzheimer's Association. Their website, www.alz.org, has some great caregiver training workshops, and you can find lots more online. So just a recap of the brain health tips for caregivers. Again, finding small ways to make changes in your life that could have a big impact. And just a reminder, you will get all the slides, so you'll have all of these tips by next week. Finally, some resources for caregivers. My agency, the Department for Aging and Rehab Services, we support Dementia Capable Virginia. Right now, that's just one web page, but it has a lot of great resources on it for you. We're expanding that out, and hopefully by the start of 2026, we'll have a big new website with lots more information that will help you. Virginia Lifespan Respite Voucher Program. This is a program that can provide you reimbursement for respite spending for your loved one, and you can access information about that on that link here. Healthy Brain Virginia is an initiative of the Virginia Department of Health to support Virginians' brain health. Again, lots of great information there. And then finally, the Alzheimer's Association, both their website, which I mentioned, and their 24/7 helpline can be helpful if you're exploring, wondering what I can do beyond what you've learned today. You can always chat with them. So these are my contact details. Again, you'll get these on with the slides. But if you have any further questions or are looking for some more information after the webinar, please don't hesitate to give me an email or give me a call. Okay, so Catherine, would you like me to stop sharing my screen?
Yes, thank you so much, George, for your great presentation. Now, we would like to invite the audience members to submit their questions in the Q&A box. And we do have a question. Have any vitamins or supplements been proven to be beneficial for brain health?
Yeah, that's a great question, and one I often get. So you've probably seen ads for supplements on television that say they're going to help prevent dementia or reduce your risk of developing dementia. Often, unfortunately, those supplements haven't had the rigorous randomized controlled trials that really would provide the evidence that they work. But they're all different, and the studies that have been done on those vary in quality. And it's really best to talk to your healthcare professional about what would be good for you. Uh, Supplements can interact with other medications you may be taking, so really important to have a pharmacist or a doctor review those before you start adding supplements to your healthcare regime. Um, and then really no, there's no link between any given supplement that I know that's been proven, apart from the kinds of things that are generally good for you. So vitamins and minerals that we need to get through food that are good for our heart, skin, and our body. All of those will be good for our brain health as well. Uh, but nothing that specifically, if you start taking this, you'll reduce your risk of dementia, unfortunately.
What types of dementia testing is available? If so, what type of healthcare professional does it? And does insurance cover such tests?
Right. Okay, several questions there. So there are several levels of testing when we're thinking about our cognitive health. The kind of the most, I guess, the lowest level would be what we call a memory screening tool. And these are things you may have experienced yourself at the doctor. So uh, often these little screening tools will have questions asking you what day of the week it is or what year. They'll ask you to remember a few words and repeat them later. They might ask you to count backwards by a certain um, interval. And these really just give you a indication that maybe more assessment is required or not. So we're currently rolling out a tool that's called the Alzheimer's Disease 8, AD8, and that's 8 questions that ask about your functional abilities. So are there changes in your memory or thinking? Um, are you finding it more difficult to find words? Things like that. And this screening tool, again, like the others, if you score 2 or more, it's probably a good idea to get a bit more workup. And that next level of workup would be getting having paper and pencil tests that probably last several hours, maybe getting an MRI or a PET scan of your brain so that the neurologist can see uh, any changes that might be happening there, and possibly blood or other biomarker tests. So maybe currently a spinal tap, there are some blood tests that are coming onto market that will be really helpful as well. And usually some sort of interview with somebody that knows the patient well. So that's the kind of big battery of tests that can help determine whether there's dementia and what specific type it is. So neurologists typically do those, or neuropsychologists. Your GP, or really, there's lots of folks that are doing memory screening now, so that's often much more available. And then
Okay.
insurance, uh, it really depends on your insurance. So Medicare will cover much of this. And in fact, the cognitive screening, that memory screening tool, that's supposed to be part of your annual wellness visit. So you should be getting that if you have Medicare.
Does subscribed sleeping medication help or best not to use?
Yeah. So prescription sleeping meds, it's an interesting one. Um, the research I've seen suggests that long-term use is maybe not so good, but if you just having some short-term sleep issues, then it might be really helpful. Again, your doctor would be prescribing it, so making sure that there's no interactions with other medications you might be taking. And sometimes, I guess the sleep that you're getting and why they recommend not taking it for long periods of time is that the sleep you're getting is not as good quality as what you would get naturally. So some of those activities that your brain is performing, that sleep medication may hinder those. So
Okay, thank you. This next question says, is there a difference in what's helpful for minimizing the progression of vascular dementia versus Alzheimer's?
yeah, so that's an interesting question. So with vascular dementia, it's really about your heart health. So anything that you're going to do that helps improve your heart health should help reduce or maybe slow the progression of vascular dementia. So if your stroke risk is reduced, that automatically should reduce your risk of further progression. At some point, however, it becomes kind of self-sustaining, and the connections between the neurons disappear and the neurons die, get flushed out of your brain, they don't regenerate. So um, the sorry, I'm just lost my train of thought there. Um, for compared to Alzheimer's disease, so actually, well, many people will have both types of dementia. So they'll have Alzheimer's disease overlaid with vascular dementia. And so if they're doing things to help their heart health, that may help slow the progression of their dementia, whether it's being caused by the Alzheimer's disease or the vascular dementia, full stop. As far as lifestyle interventions goes, we think that all of these things that I've been talking about are helpful in maybe slowing that progression. But there are more studies underway that should make that link clearer.
My mom clearly has some type of dementia but refuses to see a doctor. Any suggestions on how to get her to cooperate and see a doctor?
Yeah, so that's a really interesting one. And unfortunately, I hear that quite a lot from folks that they're unwilling to see a doctor because they're afraid of that diagnosis. And um, unfortunately, there's not a lot you can do. You can try and maybe see if you can find a doctor who will come to the home to at least get some initial assessment done. Uh, you can maybe bring your loved one, your mom, to an appointment that's for you, and then the doctor talks to her too, something like that. But it's difficult to make people do something that they don't want to do. So again, that's a something where the Alzheimer's Association's helpline can help with strategies for those kinds of problems.
Thank you. What was the name of the genetic test you mentioned for Alzheimer's? Are there genetic tests for other types of dementia?
Yeah, that's a great question. So there is a genetic test that will show whether you have that APOE4 gene that I mentioned. That's the gene that's most associated with Alzheimer's disease. But even if you have two copies of it, it means your risk is higher than for somebody who doesn't, but it doesn't mean you're going to get Alzheimer's disease. So the jury's out on whether you should get that test. As more treatments come out, there have been a few new treatments approved in the last couple of years. As more treatments come out, it may be necessary to show that you have that gene, and therefore that genetic test may be indicated. But at this point, it may make you more worried than give you better knowledge. For other dementias, the genetic risk factors aren't as clear cut as they are. There's no gene like the APOE4 gene that's linked with Lewy body dementia, for example, or frontotemporal dementia. So you're not going to get much information about your dementia risk for those types of dementia from a genetic test.
At what age should minor hearing loss be concerning? Does it depend on the severity? For example, is it recommended to have a hearing test? And if your hearing screening is normal, but you notice a mild decline, what is recommended?
So I don't know what the exact guidelines are, but generally speaking, for most of these types of things, it's important to get a baseline. If you're worried about your hearing, then it's probably a good sign, a good indication that you should get it checked out. I know, hearing loss is a natural thing. As we age, we lose our hearing. That's to a greater or lesser degree. So it's a natural process. There are some suggestions that maybe people who are Gen X and younger are experiencing maybe faster uh, or more increases in memory and sorry, in hearing loss because of exposure to clubs and things like that. But generally speaking, if you are concerned, get it checked out. Always worthwhile, and better to start sooner rather than later. You don't want to be so as your brain is deprived of that stimulation, those connections are going to start disappearing. So better to get that support in sooner, maintain those connections, maintain that information coming into your brain.
Is dizziness associated with dementia, decreasing brain size, etc.? My mother has debilitating dizziness for the past several years, along with cognitive decline. Any suggestions?
I really don't. I'm sorry, but I'm not aware of any links between chronic dizziness and dementia. Of course, it may impact your fall risk, and so making sure that somebody or that there's supports available while she's walking or getting around the house, things like that, to make sure she doesn't fall. Uh, that would certainly help maybe mitigate dementia risk, but I don't know of any direct connections between dizziness and dementia. Sorry.
Is the link between is there a link between overweight and dementia?
Yeah, so midlife obesity was one of the risk factors that was on that table I showed you right at the beginning. Um, Again, being overweight puts strain on your heart. And so that can make it more difficult for your heart to deliver the needed nutrients and oxygen to your brain. So that's where that link is. So, you know, what's good for your heart is good for your brain. So if losing weight puts less strain on your heart, then that's a good thing to do.
As a caregiver, what can I do when my husband begins to speak nonsense? I know it's the disease, Parkinson's, that is causing it, but he does lose his temper in when I don't understand what he is saying.
Yeah, that's a really hard one. So maybe the best thing to do, I, again, not knowing exactly how your husband reacts and what's happening in the situation in the moment. Um, being patient, being as understanding as you can possibly be, show that you're listening and trying to understand. Maybe you can get some meaning from the tone or the flow of words. Sometimes you don't need to know exactly what the words are to get meaning from what they're saying. But it's obviously difficult and it's going to be frustrating for him and for you. And maybe recognize that. Say, I see you're getting frustrated, but I'm really trying to understand. Maybe you can point to what you're talking about, or maybe you can show me a different way. Maybe you can draw something. So maybe trying to think about other ways of that he can communicate might be helpful.
My husband, who is in his early 50s, has been diagnosed with acute hearing loss and is a high risk sign for early dementia. Is this a high risk sign for early dementia?
So it depends how he's compensating for that, I guess. So if he is able to use hearing aids and or some other intervention that helps maintain at least some of his hearing, ways of maintain just making sure that you're maintaining communication can be really important. Um, it, I mean, I would think that that would have an impact on his brain function, but it wouldn't necessarily lead to dementia.
What suggestions do you have for brain memory work for someone with signs of dementia with vision loss?
Oh, that's a that's a tricky question. Yeah, so maybe trying to come up with some audio stimulation exercises. So uh, there are, I know there's the Stronger Memory program in Northern Virginia where you ask people to do lots of easy arithmetic and things like that, and writing things down. So the writing things down might be difficult, but you could do the arithmetic problems verbally. So maybe having somebody practice verbal exercises with the person would be the most helpful.
Thank you. High LDL cholesterol was listed on your first slide as a new finding. Did the study that found this finding promote the use of statins to reduce dementia risk?
Yeah, that's a great question. So the when I say new, so the research that uh, showed that link has been there has been I try to say there has been research that shows that link for a while, but the quality of that research evidence wasn't strong enough for it to be included as a risk factor by the Lancet Commission until recently. So I don't know the details of the exact study, or maybe it was studies that typically it's more than one that prompted that inclusion of high LDL cholesterol. But sorry, I forgot the last bit of the question.
Sure, let me go back to that for you. Did the study find that this finding promote the
Oh,
use of
stats.
statins?
That's right. Yeah. So again, I don't know the details of the study, but certainly if you have high LDL cholesterol, one of the simplest ways to address it is to prescribe statins. So sure, if that's going to get your cholesterol down, there are other ways. Of course, lifestyle changes can help reduce your cholesterol, but statins are, they're an efficacious way of doing that. So yes,
Thank you so much, George. We are at the end of the hour, and I wanted to thank you, George, so much for staying a little longer because we had so many wonderful questions that you did provide us with answers. And also wanted to thank the audience for spending this past hour with us. We are so appreciative of your time and willingness um, to to support the families, and George, for you to present for the families. I also wanted to thank, um, again, you all, but also inviting you to our next webinar, which is Understanding the Parkinson's Disease on Wednesday, September 17th from 12 to 1. Again, I just wanted to also remind you all to please fill out the survey because this information we take and generate future programs for our caregiving community. And I hope that everyone has a wonderful afternoon. Thank you so much.
thank you.